I'm looking at a note right now from Christine Arnold at Cowen. She describes what happened yesterday as a sigh of relief. Had this been priced in, or was this unexpected good news?
Yeah, it definitely hadn't been priced in, Brendan. I think that the reason for that was there was so much uncertainty in terms of what the Supreme Court would do. And so the hospital stocks were trading up anywhere from 8 to 15%. And then folks figured that broadly there was consensus that it would be a positive decision, but it just wasn't clear how much that would be in terms of price.
And what's so cool here, Jason, and Jason knows this, of course, Brendan, Tenet has 108,000 employees. It's like half of J.P. Morgan. I didn't know that. It's huge.
Well, walk us through the distinctions between health insurers and hospitals. For whom is it better?
Yeah, it's definitely better for hospitals because they had to treat these patients anyway. So pre-Obamacare, they were treating patients and they were writing off up to 30% of their revenue. So now, with Obamacare, they're essentially getting all this additional revenue. So for them, it's a big deal. They could have lost 6.4 million people, but those people keep their insurance. So for them, it's bad debt expense that now they don't have to face. Whereas insurers, they do have additional people that have health insurance, and they do get earnings from that. But it's not as substantial in terms of the earnings that they get because they have to spend a lot of it in terms of health care costs.
Okay, so, you know, I'm looking at a note from Jennifer Lynch at BMO. She said we're going to see short-term rotation out of managed care and into hospitals. So this is so much better for hospitals that we're going to see that movement.
You know, that's possible. I think the other thing is that there are about 22 states that have decided not to expand Medicaid, and the bulls would say, hey, a number of these states are considering expanding. So there's a long-term thesis that that side of the sector could still see some upside. But even in health insurance, we've heard some M&A rumors, and there's still some optimism there. So the whole sector's really had a lot of interest in it.
I want to go to what our audience is interested in, which is the state of our hospitals right now. Bring up the chart, Loriana. This is Tenet Healthcare, and it shows the different Supreme Court decisions. There's a signing of the Affordable Care Act way over there in 2010, and then the first decision, and on we go to yesterday's decision. There's sort of, I'm thinking here, buying the rumor, selling the Supreme Court decision. What exactly is the margin state of these entities? Are they making more money than they were in 2010?
Yeah, absolutely. So we talked about that 30% of revenue that they had to write off pre-Obamacare, and that's gone down by anywhere from 3 to 5 percentage points. So it's the margins have absolutely improved, and their EBITDA margins have definitely improved upwards of 15 to 20%. On total.
So that unlike a given city hospital in a given big American city, these machines make money. They wake up every quarter, sort of like cable TV, and go, we know we're going to make money. Do I have that right?
Yeah, and keep in mind that that's different for the for-profit hospitals, whereas the non-for-profit hospitals, they have higher costs. They're typically teaching hospitals, and they invest a lot more. And so it's a little bit different story here for the for-profit hospitals.
Can I ask a dumb question? Is Obamacare, is the Affordable Care Act good for doctors and nurses?
You know, at first,
I can't get a straight answer.
Yeah, at first it wasn't, and that's because it's very costly law for them, and so a lot of them had to sell their practices and become part of these larger systems. Now that they are, then it actually is good, because we also got the Doc Fix signed, right? So that law, in concert with Obamacare, it's not so bad, because now all these new patients are in the system. It's actually coming to be a good law.
I just learned more about this in the last 2 minutes than I've learned in like 8 days.
Aren't you glad we scheduled this block?
Very good. Very, very good. Thank you, Jason. Very good. Thanks. With Bloomberg Intelligence, Jason McGorman.